All right, welcome everyone to the Muskegon Community College Lecture Series. I'm Andy Weibel. I run the lecture series and teach philosophy at MCC. This is a series, so we do have another talk on explainable and responsible AI use on the 6th of April at 2:30 in this room. Dr. Nikola Banovic from University of Michigan will be here to give a talk on that topic. So I hope you can make that one as well. Today we are celebrating, I think, a lot of things, but one thing is 100 years at Muskegon Community College. This is our centennial year, and so the lecture series is a part of that celebration. So thank you for being here to celebrate 100 years, as well as to learn about climate change, drought, and human health. I'd also like to thank a few people, Academic Affairs, for helping fund the lecture series. And I'd like to thank Amber Kumpf for connecting us to today's speaker and to AGU, the American Geophysical Union, and their distinguished lecture series for helping to arrange this. So I want to thank them as well. The mission of AGU College of Fellows is to foster excellence, integrity, and interdisciplinary collaboration in the earth and space sciences, provide expert and strategic advice on global scientific issues, and support the professional development and engagement of scientists at all career stages and from all backgrounds. Dr. Abadi is coming to us via Zoom, as you can see here, and we'll be speaking for about 45 to 55 minutes, and then we'll have about 15 minutes or so for questions. I handed out a few cards if you want to do it that way, or if you want to raise your hand, you can do that as well. I'll probably have to repeat the questions so you can hear them, but do get your questions ready. I guess Ed has a quick presentation, hopefully. Yes, I didn't ask for this, but he's going to do it.
Good afternoon, everyone. I'm Ed Breitenbach, Dean of Instruction and Assessment, and I just have a service award to present. This is to Dr. Andy Weibel here, 25 years. It says, thank you for your 25 years of dedication and service to Muskegon Community College students and community.
Thank you, Ed. And again, thanks to Academic Affairs for funding the lecture series. I've been here 25 years plus now, and I think the lecture series has been around 24, 23 years, so just about as long as I've been here. So it's been a pleasure to have that. And I'm looking forward to today's speaker. A few words. Dr. Azar Abadi is an assistant professor of environmental health sciences at the University of Alabama, Birmingham. She has a BA in math and an MA in meteorology from the University of Tehran, and a PhD in meteorology from the University of Nebraska at Lincoln. Dr. Abadi is cross-trained in climatology and meteorology and environmental epidemiology. Her research interests focus on, first, exploring and better understanding the role of climate and natural environment on public health, and second, on investigating how those impacts vary by demographic characteristics and social determinants of health indicators, all of which she'll be sharing with us this afternoon in her talk, Drought and Human Health in a Warming World, How Climate Change and Drought Impact Human Health. Please help me welcome Dr. Azar Abadi.
Thank you. Well, congratulations on the centennial year for you. And also thank you for having me. I'm going to share my screen. Just bear with me. I'm going to share my entire screen because I don't see my PowerPoint, but please let me know if you can see my PowerPoint. Great. Well, thank you so much for being here. As Dr. Weibel mentioned, I hear some echo. Do you hear that too? Okay, so oh, perfect, thanks. So I'm an assistant professor in the environmental health sciences at School of Public Health here at Birmingham, Alabama. And I've been here for almost 3 years, and this morning we had snow for the first time. So climate is really changing for sure. So today I'm going to talk about the impacts of climate change on human health and with a special case of drought on human health. Um, this one. So probably most of you know that climate change has increased the temperature globally, and some of you might know the differences between climate variability and climate change. So the climate variability, as you can see, that's these natural warming and cooling in the blue that you can see here. And they happen because of the climate patterns, because of the, you probably have heard about ENSO, the Southern Oscillation, and also, like Pacific Decadal Oscillation. And these are called climate patterns or teleconnection patterns that pressure changes, like atmospheric pressure changes or temperature changes at some point at somewhere, like in the globe, and we will see impacts in other parts of the globe. And these are all connected. So that they will cause fluctuations in the winters, in the summer, and they usually fluctuates around the mean, as you can see here. And then we have the climate change, which has the combination of the human-induced warming, as you can see in orange, and also these climate variabilities in the blue. So that's the combination that you can see in the combined response in red here. Um, so probably know that the 10 warmest years on record has happened in the last decade. All of them has happened, like in the last decade. And for the first time in 2024, the temperature exceeded the Paris Agreement. And 2025 was a little bit cooler than 2024, but it's still one of the warmest years on record. And these warming climate has increased the billion-dollar disasters across the country. And NOAA, the National Oceanic Atmospheric Administration, used to track these billion-dollar disasters, but with the new administration, they had to stop, and they haven't followed up after, I think, early 2025. But fortunately, Climate Central has continued that effort, and they are tracking those billion-dollar disasters every year. So this is for 2025, and you can see in different parts of the country, we have had these billion-dollar disasters like tornadoes, clusters, and hurricane, severe storms, drought, and wildfire. One of the major events was the wildfire that happened in January 2025 in Southern California. So this one was a snapshot of 2025 billion-dollar disasters. This shows a time series of those billion-dollar disasters since 1980. They have followed those, tracked those billion-dollar disasters, and you can see that in terms of the number of those events and also the cost of those events, we have had an ever-increasing trend for both of them. Some of the 2025 actually was one of the costliest years in the history of the United States after 2023 and 2024. And we had multiple disasters across the country, from the flood that happened in Texas, the tornado clusters that happened in the South, and we had drought in multiple regions in the country, and also the wildfire that happened in California. A growing region means increased climate risks. So what I mean by that, it means that the climate risks are increasing both in terms of exposure and both in terms of population growth. So as you can see in this figure here, this shows the change in the county population in 2020 compared to 2010. And you can see some areas have seen growth in the population, like Florida, northern Georgia, Tennessee, And some areas, mostly rural areas, are seeing less, like less population and like out migration from those areas, which usually leaves older population behind. And with the increase in these climate risks, that makes the rural communities even more vulnerable compared to now. And also, this one shows the projected change in the county population in 2050 compared to 2010. So this trend will continue, and you see that Florida, which was one of the like the highest climate risk in the country, you can see like the outgrowth in the population, and also like some areas like Atlanta area in Georgia and other urban areas are getting like more populated, and some other areas, rural areas in Alabama and Mississippi and Louisiana, they have a negative population growth. And this one shows the $1 billion disaster by a state, and you can see all these countries, all these states in the southeast have seen $1 billion disasters, some more than the others. But this shows that like this area is prone to like those climate disasters. And I picked southeast as an example. This happens in every parts of the country. And this one shows the southeast hurricane landfalls through years from 2018. This is just from 2018 to 2022. And this one shows the we have more climate risks. Like this one is showing the flood-related average annual losses in 2050 compared to 2020. And you can see those coastal areas are actually very vulnerable in terms of like having more flood risks. And this one shows the rental housing unit as at risk. So it shows that we have some overlap where the population is moving and where we will see more climate hazards in the future. And there are existing present-day health inequities in those areas as well. So you are familiar with the Black Belt region in Alabama, which is part of this larger region here. This shows, like some of the most vulnerable areas, and in the next slide, I will show you this has, like one of the most vulnerable areas in terms of climate exposure, climate disasters exposures as well. This one shows some overlap between the extreme heat days that you can see right here with the darker colors. And this one here shows, this is a bivariate map showing the community of colors and the percent energy burden household. So the darker color means that there are higher population of the color in those areas, and also higher percentage of those households are energy burdened. So these areas shows that overlap. And as you can, like if you can compare that with the extreme heat days here, and you see there's a good overlap between the exposure and the vulnerability in those regions as well. And this is an example for the air pollution. This is the present day from 2000 to 2019 average PM 2.5 levels. And this one shows the projected changes in annual premature death. And you can see there's a good overlap between these pollution and premature death in the future. These disasters aren't just about property damages, they are public health crises. So you probably have seen this graph before. This came out like a few years ago, talking about the climate change or summarizing climate change and human health. These are the drivers that we are talking about when we are talking about climate change: more extreme weather, rising sea level, increasing CO2 levels, rising temperatures. And they will change the environment. This is the pathway. They change the environment, that degradation in air quality, changes in vector ecology, increasing allergens, water quality impacts, water and food supply impacts, for example, as drought, water quality impacts. It might be flooding, it might be drought, environmental degradation, extreme heat and severe weather. And these will in turn affect the human health through different outcomes. Like, for example, a degradation in air quality might, like lead to asthma or cardiovascular diseases, or changes in vector ecology have been connected to malaria, dengue, Lyme disease, Zika, West Nile virus, and so on. You can see some of these examples here. This is only focused on the physical changes in the atmosphere. So that's the primary impact. This one is basically showing the same thing, but adding another layer of secondary effects here. So we have the exposure here, we have the environmental effects that we talked about. It might be drought, it might be flooding, it might be extreme heat. And then these are the secondary impacts, secondary effects, like when we talk about extreme heat, and then we have another layer of urban heat. So those urban areas, you probably have heard about urban heat island. And also that will, for example, if you're seeing more drought, we might see more extreme heat days, more intense wildfires, um, and like so on with other impacts that you can see here. And then they will lead to health impacts that we talked in the previous slide. This one is another version of showing how climate change impacts health impacts health, human health. The difference here is that in the previous ones, they were not considering the social dynamics. So we have the direct effect of the storms, drought, flood, heat wave, and then we have the indirect effects. Okay, so the storm will change the water quality, the flooding or the drought will change the water quality. But the existing social status or the existing health conditions, or like the age and gender categories of those communities, that matters too. So the impact is not felt equally in like all the population subpopulation. So age and gender is a risk factor, like elderlies or like younger, the kids are more like vulnerable to climate change and these impacts. The health status matters, like if someone has a chronic condition, an existing chronic condition, or like they're living in a highly like socially vulnerable areas, like a more like red line areas. The social capital matters, and also like the public health infrastructure, like rural versus urban, like you have more access to public health, like medical services rather than like rural areas. And they will have these health outcomes that they were mentioned in the previous slides too. So it's a very complicated, very interdisciplinary subject. Some of you might be familiar with the climate epidemiology. So what I have talked about so far, that's the basics for the climate epidemiology. So it's basically combining the climate science, the climate exposure with the epidemiology. And to answer these questions, how can we better understand stressors in terms of climate exposures, or how do we improve our ability to collect data either in the epidemiology or like the connection with the climate exposure? And this is a very interdisciplinary topic, as you can see, with like all these exposures being involved, and so it has like consequences for the policy and everything. I'm gonna go over some of the examples of, so I gave you a summary of how climate change with those like pathways, changes in the environment affect health, but that was the large picture view. I'm gonna dive in more in like some of the examples, like extreme heat and health, extreme temperature and health. So this is from a study that showed like both extreme cold temperature and extreme heat temperature, extremely hot temperatures, they both have an impact on health. It's not like symmetrical, but both extreme hot and extreme cold increase the risk of the mortality, relative risk of the mortality. If we want to summarize based on like some of the systematic reviews that are out there and have studied the impacts of extreme heat and health, this is a good summary of like how it affects you. So it can be a general physiology like dehydration, fatigue, nausea, fever, and it will affect the cardiovascular system like heart attack, or like drop in blood pressure, irregular pulse. It also affects the skin with the sunburn, with the heat rash, and also skin cancer risk. And I'm just mentioning like some of these. You can see most of them listed here. It also affects the musculoskeletal system with the heat edema, or like heat cramps. And some, like populations, subpopulations are more vulnerable, like pregnant women or children. In pregnancy, like the heat might affect lungs, the pregnancy with the fetal nutrition deficit, and like there has been studies connecting the extreme heat with low birth weight, preterm delivery, or stillbirth. It also affects the kidneys with the dehydration and like lowered kidney function and so on. So this was an example for the extreme heat. Another example is with the wildfire, how wildfire affects health outcome. The wildfire particulate matter has been associated with cardiovascular disease, with the systematic inflammation, with respiratory diseases, and with some, like brain issues. It doesn't affect, like everyone the same way. So this is showing, like a lifetime exposure. So it affects pregnant women different way that different than like adolescent or like elderlies. Like for example, in pregnant people with the maternal exposure, it has been associated with gestational diabetes or hypertension. With prenatal exposure, it has been associated with birth weights, preterm labor, and as you can see, like these are the different reasons why. So the immune system hasn't formed yet, or it continues to develop. And so when they're exposed early on to these, like contaminants in terms of wildfire pollutants, they'll see, like different outcomes. And some of them are acute and some of them are chronic. You can see in these different colors. And also, like it can affect early childhood in a different way, increasing asthma, respiratory diseases, and decreased immune responses. Adolescents, it increases asthma, respiratory diseases, metabolic disorders, and obesity. And with the elderly, there has been studies showing that the cardiovascular and respiratory diseases goes up, or there's an increased risk. Another example is with the climate change and mental health. This is showing the drivers. This is showing the exposures to these multiple, like the climate drivers, like the tornadoes, flooding, wildfire, extreme heat, and drought. And it's showing that it affects the physical health, like changes in fitness and activity level, and it affects mental health, and mental health and physical health are intertwined. So if someone has chronic conditions and like heat or extreme heat is physically like affecting that person, we can expect to see like some mental health, like discomfort, or like some mental health issues like stress, anxiety, depression in those communities as well. And also it affects the community health. And again, community health is intertwined with the mental health, and these are all connected concepts. So they shouldn't be isolated in terms of, like studying these impacts. Everything should be considered at the same time, which makes it very challenging actually. This is another diagram summarizing the climate change and mental health impacts. So it has direct effects like direct exposure to heat, to floods, like someone can lose, like a house with a tornado or with a hurricane. That's a direct effect. And then we have indirect effects, like if there are drought in the region, we might have, we might see forced migration, displacements, hunger, water scarcity, malnutrition, and they all have an impact on, like on the community's mental health. And then we have these intersectional effects. If you have social inequality, social exclusion, like for example, the impact on drought on the forced migration, it's very different in the rural communities versus urban communities. So these factors of, like social inequalities actually have a significant impact on those outcomes, which in this case is the adverse mental health with anxiety disorders, PTSD, and so on. So just to summarize this climate change and health impacts, the larger picture, this graph is doing a great job to showing that when we talk about climate change, we are talking about disruptions of the ecosystem, which has direct health impacts like allergy, asthma, food and water, and insect-borne illnesses. So these are the physical illnesses. And then we have the disruption to societal systems, which is with the diminished food production, damage to infrastructure. So they will lead to malnutrition, work capacity, conflict, mental health illnesses. And then this is a combination of these disruption to societal systems and also the disruption to ecosystems. And then here it shows that not everyone feel those impacts equally. So there are more vulnerable population like children, or older adults, pregnant women, and some communities of color, limited English proficiency, immigrants, indigenous people, low income, and some occupational groups like athletes, the like the people that have to work outside, for example, in the extreme heat. And also we have the persons with disability, pre-existing or chronic medical conditions. So that was the summary of how climate change affects health. Now I'm switching to how drought, this is a special case of drought, affects health. These two plots shows that with climate change, the intensity of the drought and the frequency of the drought is changing across the world, and these are the more vulnerable or drying regions across the world, which you can see the southwestern of the United States is one of them, and it's showing that above the 2-degree global warming level, this is not linear anymore. It kind of turns non-linear, and it kind of like accelerate in terms of increasing in the intensity and increasing in the frequency. So by the frequency, it means that we will see more drought, and then we will see more severe droughts. Going back to the plot that I showed you with the billion-dollar disasters, so this is a combination of all of those, like events with winter storm, wildfire, and, like up to drought. This is showing the drought time series. So you can see in the United States from 1980 to 2025 to 2024, the frequency of the drought has changed. And also we have had some years that, like the cost has been really high, which like 1990s was one of them, or 1980s, end of 1980s. And also with the drought that happened in 2012, which most of the US was covered by severe drought at some point. Those has been examples that the cost was really high. If you look at the total cost and the deaths per year, drought only falls behind tropical cyclone and severe storms in terms of cost. And when it comes to the number of deaths, it's actually the second deadliest disasters in the United States after tropical cyclones. But most of these other events that you can see here, they have immediate impacts. Drought is very challenging. Drought is traditionally a very gradual, evolving phenomena that might, like happen during, like multiple years, or it might happen, like during a few weeks, which flash drought is that case. And then, like it might happen over, like multiple years, that most of, like the California droughts fall in that category of mega droughts. And in the billion-dollar disasters, when they looked at the death, those are mostly associated with the heat waves. But there are many, many other causes of death associated with drought that it's not considered here. So that's an underestimation for the number of deaths per year for the drought. Some of the recent drought events that have had catastrophic, like consequences. One was related to the California wildfire that happened in January 2025. A couple of months before that, they had they were in severe drought, and then the high winds and extreme temperature that ended up to having that Palisade and Eaton wildfire that we saw last year. Other examples of the severe droughts the past couple of years, one was the Mississippi River in 2023, and you can see the water was very low, that the sandbags were showing in the river, and it caused the saltwater intrusion. So the saltwater got into the Mississippi River, and it was threatening the drinking water for most of Mississippi and mainly in Louisiana, in the Baton Rouge, Louisiana, and also New Orleans. That this happened in this is taken from September 14, 2023, and in September 27, they declared a state of emergency for Louisiana because the drinking water was threatened really badly. And this shows a year after that, in fall 2024, that you can see most of the southern states were in severe drought in the next fall as well. World Meteorological Organization, or WMO, is the weather agency at one of the sections of the UN. And they had a report that showed that droughts are the leading cause of death from the world's worst disasters in the last 50 years. So when we talk about drought, you usually probably will only think about the lack of precipitation for a while. But in the topic of droughts, there are different types of drought that we can consider, and most of them have been termed for agricultural or hydrological purposes. So when I talk about time scales, I'm talking about these different types of drought. So meteorological drought is the short-term dryness, which is usually felt by precipitation deficit, and it's effective at the surface. And then if the drought, is elongated more than a couple of months, it starts affecting the soil water deficit, and then you will see the impact on the vegetation stress, reduced production, biomass, and yield. And this is called a moderate dryness, or not medium-term dryness, not a moderate. And this is coined as agricultural drought. And then anything further than that, like 9 months, above 12 months of lack of precipitation and dryness, that it starts affecting the surface and groundwater deficit, and we'll see the impact on the reduced stream flow, groundwater levels, reservoirs, and wetlands. That is called hydrological drought. And anything above that, if we have a drought more than a year, we will start seeing the impacts on the environment, economy, society, with the food prices, with like environmental degradation, and that's called socioeconomic drought. In this one, I try to summarize how drought affects health. So as you can see, this is the drought event here on the top, and then we have the environmental changes here in the greenish color, greenish box. So droughts will affect soil degradation, reduce surface water, lower groundwater levels, vegetation loss, increased wildfire, air quality degradation. And then it will have direct effect and indirect effect on the society. With the direct effect is the water scarcity, crop failure, livestock loss, heat stress, and indirect effect would be food insecurity, poor water quality, migration, and displacement. And then there are the social factors in the community that affects, like the later on, like how health is affected. So like age and gender matters, health status matters. This is like very similar to what I covered in the climate change and health. Socioeconomic status, public health infrastructure, mobility and conflict. And these in turn will lead to some of these health outcomes that have been related to or associated to drought, like undernutrition, mental illness, respiratory diseases, infectious diseases, and injuries. This is showing the different types of drought. So we talked about the short-term drought versus long-term drought in terms of like meteorological droughts, hydrological drought, agricultural drought. This is showing the droughts in the scale. So we can have flash droughts that only happens, only last for a couple of weeks. That goes from, like a moderate, like dryness to a severe or exceptional dryness in a very short period of time. Or we can have, like more of the traditional drought that happens, like over months, over years, or even over decades. So there's a huge difference between this flash drought and other types of drought that I will talk about it. if you are not familiar with the U.S. Drought Monitor, that's the with the National Drought Mitigation Center in Lincoln, Nebraska. They create these weekly maps to show the drought status everywhere in the U.S. And you probably have seen some of these colors, and which means D0 is abnormally dry. That like these are the possible impacts. D1 is moderate drought, up to D4, which is the exceptional drought. So if you see D0 to D4, like somewhere, that what it means in terms of drought. And then we have the flash drought, which is a very different, like beast compared to the traditional drought. This was, I think the term was coined in 2005 by one of the faculties in the National Drought Mitigation Centers in Lincoln, Nebraska. The flash drought has a rapid onset and intensification. That's what makes it different from the other types of drought. And then it has interactions with other climate stressors like extreme heat, wildfire might happen, degraded air quality, and also the impacts would be economic stress, social disruption, food insecurity. So the difference between the flash drought and in terms of preparation or management is that this will take you by surprise. Like it will go from D0 to D4 in a matter of like a couple of weeks. So that makes the preparation and management very challenging. In the other droughts, and also the forecasting for flash drought is very challenging as well. Okay, so I talked about the different types of drought and the physical changes of the atmosphere when we talked about the drought, and also I talked about the drought and physical impacts. Now I want to talk about the drought and mental health. So these are the components of like when you ask a question and when you want to like understand a concept better, these are the components that you will go through. These are the steps that you will go through. You will start with the intuition, and then you will go to a concept, and then you will seek evidence to kind of like prove that like okay, this is the case, this is, what's happening. And I'll go over the steps here. So in terms of drought and mental health, intuition. So when we see a farmer struggling in the drought, intuitively we can like connect the dots that like something might be wrong, or like the drought might cause this like dissatisfaction, or like the hopelessness feeling, or when we see like all these dust in these dry lands, or like the lost animals or the livestock in those like dry areas. So intuitively we will think that like something might be wrong. And then the concept. So for so long, if you're not familiar with the streetlight effect, so this guy is looking for his keys here, and there's a police officer here asking, did you lost your key here? And the guy says, no, I lost it in the park, but this is where the light is. So mental health topic has been so long, like focused on the physical, like physiology, or like the gene, and they have been focused on where the light has been. But it's a very combined, it's a combination of multiple, like risk factors. That genes is one of them, biology is one of them, environment is one of them, and lifestyle is one of them. And for so long, like we have been only focused on the genes and biology, that we have kind of ignored these other risk factors. So conceptually, like we can connect the drought and mental health. And then we have evidence. This is a systematic review that was done in 2015, and so these are the number of studies that you see in the parenthesis that shows, for example, drought has been associated with employment and financial constraints, depressed economy, and then there are like associations with this here, with the depression and depressive symptoms, which is one of the outcomes of the mental health. And then like some of these have been connected to suicide, have been associated with the suicide. So this is a very comprehensive pathway showing how drought affects mental health, and like in extreme cases to suicide. here I try to kind of summarize how drought affects mental health. So these are the types of drought that I talked about. And then this is the primary impact channel in terms of livelihood, economic insecurity, living conditions. And then we have these social determinants of health and vulnerability factors like economic and structure or demographic and cultural, social and psychological, psychosocial, like, like the social exclusion, or, like living in rural areas versus, like urban areas. They all are risk factors, and then they will lead to some behavioral issues with, like with the substance use, for example, or physical with the heat illness, respiratory issues. And I talked about, like how behavioral or mental health and physical are connected, are interconnected, and other health outcomes, mental health outcomes. Okay. Now that I covered how drought affects health and physical health and mental health, I want to go quickly over some of my studies that I have done in the past couple of years on drought and health. So one of them was the lethal connection. That was we studied the association between drought and firearm and non-firearm suicides among U.S. adults. Just the background, the suicide rates has been on the rise in the United States since 2000, and then we had a very, like a subtle dip in the COVID years, but it quickly went back to pre-COVID years after that. The firearm, these are the different mechanisms over time. So firearm in the rural has had the highest rate of the suicide, followed by firearm in the urban. So firearm has been the common, like method for suicide. And then the other ones have been on the rise as well, with like suffocation, poisoning. So in terms of the suicide methods, more than 50% of the suicides are done by firearm mechanisms. So when I searched for the circumstances that increase suicide risk in CDC, I summarize these, what they mention in terms of individual risk factors, like if they had previous suicide attempt, or history of depression and other mental health illnesses, or the relationship risk factors, if they were, like loss of a relationship, divorce, like bullying, high conflict or violent relationships. And then also community risk factors. If there has been a cluster, like a suicide cluster in the community, or lack of access to healthcare. And then also we have societal risk factors like a stigma associated with health seeking and mental illness, easy access to lethal means of suicide among people at risk, and unsafe media portrayals of suicide. But guess what? Weather is usually not discussed as a risk factor for suicide. We have had multiple studies showing extreme heat and, like suicide, or extreme heat and mental health. But weather is not usually a risk factor. So in this research, we use the 12-month and 6 months. So this is the long-term drought versus medium-term drought. And the outcomes were firearm suicide and non-firearm suicides. And also we had a stratified analysis by age. This was the one group, 20 to 64 and 65 plus, male, female, and metro versus non-metro counties in the United States. I haven't talked about the drought matrices. So I talked about drought as an exposure. So it's an imbalance between moisture supply and demand. And there are more than 150 drought indices defined, but almost all of them are for the purpose of agricultural purposes or hydrological purposes. There is no drought index defined for health, for example. And if you want to, like kind of categorize them, some of them are focused on the supply side of the moisture, like, for example, standardized precipitation index, which the only input is the precipitation. And then more recently, the attention is changing to atmospheric demand, moisture demand, like, like how thirsty the atmosphere is, or the combination of precipitation, the moisture in the air, and the temperature. So like, like SPEI, the standards of the precipitation evaporation in the evapotranspiration index, or EDI as some of those indices. So for this specific research, we used EDI, which is one of the drought indices. And I'm gonna skip these. So how we defined drought was
You can imagine that drought starts from abnormally dry, it goes to next month, it goes to severe, the month after that it goes to extreme, and then exceptional, and then will stay in exceptional drought for a couple of months, and then it has to go back to extreme, or like that's the improving phase of the drought, and then extreme, severe, and eventually like ends. So the hypothesis here was that we have a severe drought here, and we have a severe drought here as well. So if we want to like coin those, if we want to define like drought in those months, this is severe at the beginning, this is severe at the end. But the hypothesis here was these two severe exposures will have different health outcomes. One is at the beginning of the drought. People haven't seen any like environmental degradation. It's starting to like change the environment. This one has been over probably like 9 or 10 months of the drought that like the people have seen like all these dryness, and still like they're not seeing improvement enough. So it's like least impact and like the highest impact at the end. That's why we decided to like go with different phases of worsening versus the improving. So this is the worsening phase of the drought, this is the improving phase of the drought, and with the different severities like moderate to severe here and the severe to extreme or exceptional. Some of the characteristics of the population that we had. So this is based on the age for the firearm and non-firearm. You can see that most of the firearm suicides has been committed by the younger population, and that's the same for the non-firearm mechanism as well. But if you compare the 65 plus or the elderly population or the older population, they are more prone to do firearm compared to non-firearm suicide. And also it has been committed more in male compared to female, and with the firearm, like it's mostly male. With non-firearm, the difference will narrow to a smaller difference here. And then in terms of urbanicity, metro population, because of the population, we'll see more firearm and non-firearm. And you can see, again, this difference is lower than this one in the firearm versus non-firearm. And this shows that they have access to more lethal mechanisms in the non-metro areas compared to metro areas. And then in terms of exposure of the drought, 50% of the time between 2000 to 2018 was exposed to drought. So quickly going over the results, we showed that in the severe part of the drought, we see higher associations or higher incidence rate ratio between the drought and suicide. And this was stronger in the firearm compared to non-firearm. And also we saw this directionality of, so I talked about the improving phase, the worsening phase at the beginning of the drought, and improving phase at the end of the drought. For the firearm, we saw that in the worsening part, we have a slightly higher association with the suicide compared to the direction changes in the non-firearm. And the hypothesis here was that with the firearm suicides, probably only like one effort will be successful is not the best word here, but that will lead to the suicide. But with the non-firearm, it might take multiple tries to lead to to death. So this delay was what we hypothesized here. And then also we looked at the stratified analysis. So in terms of attributable death to drought or attributable suicide to drought, it was higher in the older population, it was higher in the male, and it was higher in the non-metro, and that was repeated both for the firearm and non-firearm, but slightly stronger in the firearm. So I'm just going to skip that. I talked about the results. This is another study that we did a couple of years ago with the drought severity and all-cause mortality among adults in the United States from 1968 and 2014. And these are the details. I'm going to skip that. And we saw some protective effect and some increasing incidence rate ratio. For example, in the older adults with the 45 to 64, we saw that increased mortality risk
a slightly increased mortality risk in the southwest regions, and also with the Black race. And with the other ones, there were like more protective effects. So to summarize the results for this one, there was no significant national level or the total population between drought severity and all-cause mortality, but there were significant subgroup differences in the, for example, age, race, and region. We showed that younger white adults in the South and West were more protective. And also, we also showed that the older Black adults in the Northeast and Southwest were more vulnerable in terms of drought and mortality risks. This is another example, another study that we did for a drought and all-cause and cardiovascular mortality in the Northern Rockies and Plains of the United States. These were states of Montana, Wyoming, North Dakota, South Dakota, and Nebraska. And we used 3 different indices because, as I said, there is no health-related drought index. So we just wanted to compare different indices to see, like what are the differences. And so we saw that for the shorter term drought with the 6 month, either EDI or SBEI, we saw a stronger association with drought and both cardiovascular and total death or all-cause mortality. And the association was actually higher for older population and female and white. So this is the summary for the results that I talked about. We don't have causal inferences studies on drought and health outcomes, but if you want to look at, like how drought affects, like cardiovascular, I can, like use this diagram to explain that, for example. So when we talk about droughts, like it usually happens with extreme temperature that might increase ozone or, like altered meteorology, like, like increased wildfire events, and that will lead to NO2, ozone, and PM, and also some, like damage to healthcare infrastructure. And they all have been associated with cardiovascular mortality and other, like cardiovascular issues. So that kind of, like shows the pathway, but that wasn't based on the study that we did. We just looked at the associations. This is another study that we did on drought exposure and respiratory related mortality in the United States. And for this one, we showed that severe drought was specifically, like highly associated with the respiratory death. And also when we did the stratification, we saw that older populations and also Black and white populations and a female population, and also with the non-metro, and also, like to some extent in the metro population, they were more vulnerable in terms of respiratory risk ratio. And again, similar to the cardiovascular issues, if you want to connect drought to respiratory issues, so you can see, like the increased drought here, increased wildfire here. There are mediators here with the increase in allergens, increase in pollutants, increase in molds, and then they will have different respiratory outcomes like impaired prenatal and postnatal pulmonary development, or, like pulmonary infection or asthma exacerbation. And then this is the last study that I want to showcase. So in this one that was published last year, we showed the mortality attributable to drought and wildfire smoke and their concurrent added effects in the contiguous US. So for this one, we show the attributable death for separate events of the drought and wildfire, and then the added burden of both events at the same time. So as you can see, these are the different periods from 2007 to 2010, and all the way up to 2021 to 2023. You can see that, like different parts of the country have been, like have had more deaths in different periods for the drought. These are specifically for the drought. So this is the famous 2012 drought that, like most of the US was covered in severe drought. And also in 2021 to 2023, we had droughts in the western US.
This is for the wildfire. 2023 it was one of the worst years in terms of wildfire, and you can see the attributable death here is the highest compared to the other periods that you can see. And then this is the added burden of the two events added together. As you can see, like it changes over years, different years. And then we did some stratification based on the social vulnerability index. If you're not familiar with that, the social vulnerability index is a CDC product that kind of shows, like which areas or which counties with census tracts are more socially vulnerable in terms of, like some of these climate change impacts. And the value changes between 0 to 1. 0 is the least vulnerable, and 1 is the highest vulnerable communities. And we looked at, like this is the least vulnerable communities, and you can see the attributable deaths are not that much, and it's more attributable to droughts compared to wildfire. And then when we switch to highly vulnerable communities, we can see this, like huge added burden in terms of, like the attributable death that is both attributable to drought and wildfire and the interaction between the two. So I summarize that. Similar to the other studies, if we want to, like kind of see how drought and wildfire smokes will lead to death, this might simplify that. Like in the times of drought and extreme temperature, we'll see more wildfires, and then we will have, like these long range smoke transport, and then we have the urban emission and fire emission. With the air pollution and heat waves, other regional impacts, like like if we are living in an urban area versus rural area, we have these impacts, like higher in the urban regions, and that has been associated with excess death. Well, that was the last study that I wanted to cover, and with that, I will stop, and I will take any questions that you might have. I'm going to stop sharing, but if you have any question, I can bring the slides back.
Thank you very much. That was a great talk. And yeah, if you have questions, I'll take a card from you, or I'll be happy to, if you want to raise your hand, I can do that too. So
I know I covered lots of information.
a question here I got from a card. Can you explain urban heat island effect and how it affects communities?
Yes. So urban heat island is basically, we are talking about the heat is trapped in these, like congested urban areas. Like if you compare the heat, like on a grass or an asphalt, you can see the, like the temperature differences, like it's much higher, like in the asphalt. And because of, like all these darker surfaces, like in the urban areas, and all these, like high rises and the built-in communities with, like less greeneries and everything. So we will see more heat, like a heat dome in urban areas. If you look at a map in the US, you will see these heat domes over, like larger cities like Atlanta or, like DC, compared to the more rural areas that we have more greeneries.
Here's another question.
How long have we been tracking data on climate change with weather and disasters? Because you said over the last 10 years, you stated statistics, but how long have we been tracking data?
Can you please repeat the question for me?
Yeah, how long have you been, or how long has data been collected on climate change and a lot of what you've been speaking about? So how long, I guess, is that the right? How far back has data been collected?
I'm sorry, your voice is chopping up. I can't hear very well.
Maybe I'll get over here. So yeah, how long has data been collected on climate change and these effects? Some of what you said was 10 years, you said, and some of them longer. And so how far back gets the data?
You're talking about the global temperature?
Yes. Yes,
Oh,
or in the
that goes
U.S.?
back to 1850. And like, so back then it was started by the station measurements. So there were like a limited number of stations that they could measure the temperature. And then over time, with like all these technology developments, and like they added more stations in different like places across the world. And also in 1979, 1980, like with the satellites, and the models that they were developing. So they came in with this reanalysis data sets that kind of combine the satellite data sets, the model data sets, and the station measurements. So it has been tracked for a long time, but in terms of the billion-dollar disasters, it has been only followed since 1980.
All right, thanks. I got a question. You talked about the drought and how it affects human health negatively, from suicide to other health problems, and that a lot of communities that are vulnerable have higher risks. As far as like solutions to these problems I mean, what are some of the solutions in times of drought and heat? I mean, is it bringing more air conditioning in, or is it bringing relief stations? I don't know what seems to help, I guess.
Yeah, so in terms of drought is a very, like a intertwined, like phenomenon with other disasters. Like in terms of, like when we have drought, we probably have more extreme heat days. So whatever has worked for extreme heat, like management or, like mitigation will work for the drought as well in those concepts. But for specifically for the drought, we don't have any, like a management plan right now. I mean, I was part of this group at University of Nebraska Medical Center that they started, like, or we started building these connection with the local health departments, and it became a national effort. And there are reports coming out of, like, published reports that came out of it, that like how we can manage that in terms of collaboration with like the health departments, and being like showing the vulnerability, or like creating these infographics that people know at the time of drought, like they might be more vulnerable to these like vector-borne diseases or waterborne diseases. So it's just like in terms of increasing awareness.
All right, thanks. Here's another question. Thanks.
Thanks, Andy. Doctor, what evidence are you seeing that we are either on the public side or on the private side, or both, that we're tackling these impacts, negative impacts on our human health here in the U.S.?
Did you hear
Sorry,
that?
can you, when you get away from the podium, I guess, like
Okay.
it gets very.
All right. Well, we're figuring this out. I'll try to repeat the question. So,
Thank you.
what evidence is there that we are doing a good job or not in the United States of addressing these problems from climate change and drought and whatnot?
It's a very hard question to answer in this political environment. I mean, there have been, like good progress, and then, like all these progress comes with the funding in research. And then, like when there is no funding for this research, there would be a disruption. But the impact is still there, like drought is still happening, or, like extreme heat is still happening, like Hurricane Helene is still happened. So we will go back to see, like more impacts, but there probably would be a, like a delay for, like what we can do to mitigate these impacts. Well, thank you for asking that question.
Here's another question. A lot of what you have done your research on takes place in the United States. Does the impact of drought and climate change differ when you go to other more vulnerable places in the world and different climates?
So, talking specifically about drought and health is a very relatively newer topic compared to, for example, extreme and like human health has been studied for, I don't know, like maybe 2 decades or 3 decades now. But drought, it has been less than a decade that have been, studied. And there are studies kind of like from Europe, from mostly from Spain, from South America, mostly from Brazil, and from India, like when it comes to mental health, specifically from India and Australia, they have studies on drought and mental health. So in terms of differences, yes, and it depends on like the resources that they have. For example, drought has been associated with increase in HIV in Africa, because the like the resources that they have, and it's specifically connected to their access to water, that they have to like travel long distances to get to the water. And so yeah, we don't have those problems, like, or malnutrition, or like undernutrition. That hasn't been a problem in the US, because even in the most rural areas we have like some like options to change, like in terms of nutrition at the times of drought when we don't have access to local products.
Questions? Well, I guess that's it. Thank you very much for your talk and wonderful questions. And thank you all for coming. And hope to see you on April 6th. And thank you again. One final applause.
Thank you so much for having me.
That's great. Thank you so much.
Thank you. Bye.
Bye-bye.